second live debate hosted by Resistance TV. I'm Chris Williamson, and tonight I'll be discussing the COVID-19 crisis with returning NHS doctor Sarah Gangoli and long-standing GP Dr. Bob Gill, who recently produced the seminal documentary, The Great NHS Heist. The NHS response to the coronavirus comes after 40 years of being battered by neoliberal ideology. It started with the Thatcher government outsourcing support services. That was followed by the so-called internal market, which was initially scrapped after New Labour came to power in 1997. Tony Blair promised to put doctors and nurses in the driving seat, but then reintroduced competition through the so-called payments by results scheme. John Major's government brought us the private finance initiative, which was accelerated by New Labour. New Labour also signed a concordat with private health providers and invited the private health companies to compete for multi-million-pound NHS contracts. This paved the way for the coalition government's Health and Social Care Act, which amongst many other things, repealed the duty on the Secretary of State to provide a comprehensive health service, and it allowed foundation hospitals to raise 49% of their income from private patients. The previous limit was just 2%. So what effect do you think, Sarah, these changes that the National Health Service has seen over the last 40 years has had on its ability to respond to this coronavirus pandemic?
Well, firstly, thank you for the invitation tonight, Chris, and thank you for that summary, because I think it's really important that we look at this issue in context. We now have a fragmented and severely weakened health service. We have also seen, with the Health and Social Care Act, we have seen the decimation of funding for public health, which is absolutely instrumental in any response to a global health issue, such as a pandemic. But the privatisation by stealth and then moving into a more overt privatisation has seen power taken away from clinicians, more into the hands of managers and financiers. It's seen the professions within the health service systematically deprofessionalised and undermined. And it has resulted in a system that has no slack. It has no slack in either the personnel, the bed numbers, the ventilators, in any respect. So we face this crisis with severely weakened, undermined and fragmented health service.
You're on mute, Chris.
Sorry, Bob. Yeah, I was going to say to you, Bob, there was a study, wasn't there, in 2016 into the readiness of the National Health Service in the event of a pandemic like the one we're confronting now. And the rumour is that the government didn't act on the information that threw up. And I understand there's legal action now being taken to force the government to reveal the contents of that study. I mean, what's your thoughts about that study and the readiness of the NHS and indeed its unwillingness of the government to actually publish the findings of that study?
First of all, thank you, Chris, for inviting me and organising this meeting. What should be basic to any pandemic preparedness is looking at the capacity, particularly of intensive care beds and ventilators, also the staff to run those ventilators, and protective equipment, and how you're going to put in operation an action which will free up the beds. Now, in 2016, Exercise Cygnus, which is what you're referring to, which should be a public document because it's fundamentally about saving life and protecting the public, is a document that's been kept secret. I think there's been a partial leak to the Sun, which has skated over the important issues. And the chief medical officer at the time came out publicly and said, we are not prepared. In fact, a survey of doctors organized by a grassroots organization called Doctors Association UK, 99% of doctors who responded said we are not ready. So it's damning of government to have buried the report, not implemented the recommendations, And as building on what Sarah said, we enter this pandemic with 40,000 vacancies of nurses, 10,000 doctor vacancies, and having lost a further 17,000 beds in the hospital system. So contrary to what Boris Johnson is saying and Matt Hancock is saying, that we were well prepared, that's absolute and utter nonsense.
If I could just add something to that. Most of the information we have about Operation Cygnus comes from news reports at the time, so back in 2016, when apparently this wasn't released into the public domain because it was considered to be too terrifying. Now, there's nothing terrifying about being prepared. And ultimately, this is about a lack of transparency when it comes to our lack of preparedness for this pandemic. Worse still, it seems that policy did not change and the approach to preparedness did not change in response to this exercise.
And I know, Sarah, that you've expressed concerns about the inadequacy of PPE. You could say something about that, really.
Yeah, I mean, I think that there have been concerns expressed widely about the inadequacy of PPE. And I think what people have to understand is that healthcare workers who are reporting issues about PPE, they're not only concerned about protecting themselves, but they're concerned about protecting the patients who they're going to come into contact with, and also their families. Protecting workers in their place of work is determined by law. It's determined by acts of parliament, which say that workers should be protected in their place of work. Not providing workers with appropriate protection, and we know what appropriate protection is because we have guidance from the WHO and others, not providing people with appropriate protective equipment, whether it's in the health service or whether it's in social care, is in breach of legislation. And I think this is really important because it actually shows that not only are we talking about workers who are potentially being exploited, but we're also talking about patients who are potentially being put at risk because those workers are being exploited.
And of course, at the same time as the government's failed to provide PPE, we also know that the government has been refusing to pay care staff, NHS staff, a proper salary. And I remember seeing Conservative MPs cheering about the fact that they defeated a Labour motion to give nurses a pay rise, for example. And yet we see Boris Johnson and Matt Hancock and others happily encouraging people to applaud the NHS staff. I wonder whether you think, after we've got through this, whether there's likely to be a change of heart from the government, Sarah, and then perhaps Bob could comment on that as well, in relation to remunerating our NHS staff properly.
I very much doubt it, because it's not really a problem just with this government. This is a problem of ideology. This is about a government, about a system, about an ideological and economic structure which does not appreciate people who work in the public sector. In fact, it doesn't really believe that public services should exist. So I think there's very little chance that public sector workers of all kinds, whether they're teachers, whether they're healthcare professionals, are actually going to be treated properly after this. What I think is interesting is that there's been this outpouring of appreciation for people who work in the health service and all key workers, on the back of the current Home Secretary calling many of these people unskilled. And this comes from a good place. I think that, that there has been a show of community spirit and genuine appreciation for public services. But I have great concerns about this 2-minute show every week, because I think it could so easily be turned around. We've already seen that the government they're looking for scapegoats. They will not admit that they didn't react to Operation Cygnus. They will not admit that they were not prepared. Even today, we have, reinforcement of the propaganda that the UK is not doing so badly, when all you have to do is look at our figures in comparison to other countries. So I'm really concerned that when this is all over, healthcare workers and essential workers will be part of the scapegoating.
And Bob, what do you think about that? I mean, look, Boris Johnson's had his life saved by the NHS. I wonder whether that might prompt a sea change in its attitude to public services in general, and the National Health Service in particular. Are you as pessimistic as Sarah is about the potential for a change of heart or a change of direction by the present administration?
Absolutely not. And Boris and his government would love people to give them the benefit of that doubt. The reality is, we've seen over the years what has happened to the NHS. We've seen there was a study published a couple of years ago which estimated 120,000 excess deaths due to austerity. One academic labeled it economic murder. We've had a slowing down in life expectancy, and we've had a 3-year consecutive rise in infant mortality. And we also know very early on, the government voiced this idea of herd immunity and letting the population take it on the chin. Well, if you fail to test, if you fail to close the airports, if you delay locking down, either you can frame this as incompetence, or you can see it for what I think it is, quite deliberate. They are deliberately putting the most vulnerable patients and people at risk because they are expensive, they are costing us in pensions, they are costing us in healthcare. So ideologically, the loss of thousands of poor people who are costing the state does not upset the people who are running the country, I'm afraid.
Can I just add something?
Yes, of course.
There, because I think what Bob says is really significant, because not only do we have a health service which is weakened, but we have a population which is weakened, which has been ravaged by 40 years of neoliberalism and inequality. In the late 70s, a report was commissioned from Sir Francis Black. It was subsequently released in 1982, I believe, 1980, and was essentially ignored by the Thatcher government. And it quite clearly demonstrated that inequality was associated with adverse health indices. Now, this has been replicated and repeated, so we know that inequality is bad for everyone's health. It's bad for society's health. And over the last 10 years, we have had a programme of austerity which has increased inequality, and it has exacerbated the adverse effects on health indices and society in general.
What about your experience, Bob, as a GP, and presumably your interrelationship with the social care sector? Because I know that that's been almost universally entirely privatised now. We've seen on the news broadcasts social care providers, home care proprietors, and staff in the care homes actually saying how desperate the situation is in terms of a lack of PPE and how underprepared they are really to provide the care for obviously very vulnerable people that are living in those establishments. And I wonder what your feelings are about social care and what could be done, what needs to change, and what's gone wrong with social care over the last 40 years.
Again, it's very important to frame this correctly. You have the public who see the social services failing, and correctly, because they've had 50% funding cut. So you cannot provide more care with less resource. The people providing the care are doing it on minimum wage. They have to pay for their own transport from going from patient to patient. I don't know how they do it, to be honest. There's got to be the compassion that's missing in the government. They've got their share, because they are doing a very underappreciated job with a minimal resource, and they barely scrape the money together to survive and pay the bills. So these are the most exploited group of people. Now, if the government was serious in protecting and shield these vulnerable elderly people in care homes, you would institute a very strict testing program. They haven't done that. In fact, they've discharged COVID positive elderly patients back to nursing homes. Now, you don't have to be a rocket scientist to know that that is a problem. If you deliberately discharge people into a nursing home and you don't adequately protect the staff or other residents, what's going to happen?
What should we, I mean, what would your advice be then to those of us who are concerned about this? I mean, we know that the National Health Service and care services in general are held in the very highest esteem by the wider general public, and I think to even greater extent now because it's been brought into sharp focus, the crucial role that they play. But I suspect that a lot of people aren't totally familiar with the changes that have been made over the last 40 years, the way in which particularly social care, residential care homes have been almost universally privatized now. I mean, what would be your message to people watching this broadcast tonight? What can they do? What should they be saying? I mean, how can we make this change? How can we get a system that's fit for purpose?
I think it's important for people to wake up. Certainly don't get all your information from watching the BBC, because you'll be presented what the government wants you to think and no more than that. One notable exception was this week's Panorama, of course, which revealed how the government downgraded the potency of the virus to suit the lack of PPE, a blatant manipulation of their own guidance. The public are now waking up to the fact that everybody is vulnerable when their health is at risk. If you lose your health, you lose your job, you're unable to sustain your family, and soon you're out on the streets. So we all need healthcare, and we all need a competent, functioning social care to look after our elderly loved ones. Now, if you want to do that in the most cost-effective manner, you do it through taxation, you centrally fund it, and you centrally organize it, and you make sure that the outcomes are the best you can achieve. The most cost-effective way is to do that. The idea that you bring in the private sector and somehow they can miraculously do things cheaper and also suck out a profit is pure fantasy, and the public need to see that for their own eyes. One example is the privatized storage of PPE. Now, the company that was supposed to be stockpiling the PPE changed hands 3 times. That is no way to plan for an emergency. So my appeal to the public is, please open your eyes, get your information from a broader source, and tell as many people as possible that you cannot trust our politicians to do the right thing. It will take a significant grassroots movement to push our politicians to respect our wishes. Otherwise, we're going to lose the NHS, as well as we've lost social care, and we're losing education as we speak.
Just before I bring Sarah in on that point, anybody who's watching this broadcast this evening and who wants to put a question to Bob or Sarah, please feel free to do so. You can use your Facebook feed to pose a question, and we'll try and get as many questions in as we possibly can before the end of the broadcast. And we said that we'd run it for an hour this evening, so we'll leave hopefully about 20 minutes or so to give people viewing this broadcast an opportunity to ask their own questions. But Sarah, have you got any thoughts about what we should be saying, what you would like to say to the wider general public in terms of how we can, they can put pressure on our politicians and bring about the change that seems to be desperately needed?
I mean, I couldn't possibly put it better than Bob, seasoned campaigner that he is. But I think it's really important for people to arm themselves with as much knowledge as possible. Look at the key documents, look at the documents which informed, Thatcher's initial marketisation of the health service. Look at evidence from abroad. Examine what is the most efficient way to organise a healthcare system, and you don't get much more efficient than the Beveridge model, which is what we have. Educate yourselves about how healthcare systems elsewhere work. The trajectory is that we are moving towards an American-style health maintenance organisation model, and that is catastrophic. It's catastrophic for people who can't afford healthcare. So educate yourselves. As Bob says, open your eyes, get your news from broad sources. And if you need to be steered towards key documents, we'd be very happy to do that.
Well, can I come in there, Chris?
Yeah, of course, yeah.
I've made it very easy for people to educate themselves. They can watch my film.
Yes, indeed.
It's available on YouTube. Okay, it's there. We've collated all the evidence, you know, and I'll challenge anybody to say there's any factual inaccuracies in what we've said. Could I briefly return to the PPE point?
Yeah.
Now, unfortunately, we heard about the death of Dr. Peter Tunn, who was a Reading consultant, and he went on record on email demanding, pleading, begging for PPE. And unfortunately, he caught COVID and died. And there was a comment from his son, which was reported in the press. I think it was today. And this sums up the situation we're in. When a doctor has had to beg for masks, something has gone wrong. And the something that has gone wrong is the transfer of leadership and decision-making power to an unaccountable management bureaucracy. And also on top of that, you have the systematic intimidation and bullying of staff who dare to speak up. So we're living almost in a police state. And this, I have teachers, I have police officers, I have other social and public service workers as patients. And I ask them, how is it for you? And they recognize this pattern. It's across the public sector. It's something called new public management, whereby you divorce responsibility from power. And that seems to also have affected our institutions. Not unlike the Labour Party, I'm afraid to say, you have a membership wanting one thing, and you have a bureaucracy subverting their desires.
I wonder if we could maybe turn now then to the discussion that is dominating a lot of people's minds, and that is the prospects of a vaccine. And I know that there's been some concern about the emergency legislation that was passed, because as I understand it, that gives the government the powers to insist basically on a mandatory vaccination program. And very draconian powers, it seems, are taken in that legislation for anybody who is not wanting to succumb to the vaccine. They could be arrested, they could have property seized and indeed destroyed. I just wonder what your thoughts were about the civil liberties implications. Secondly, but firstly, obviously as medical practitioners, what's your thoughts about a vaccine, and how quickly do you think one can be safely developed? And then maybe you could also touch on those civil liberty issues about a mandatory vaccination program, and whether that's something you think is sensible and is something that we should support. Who wants to kick off that? Sarah, would you like to start with that one?
Yeah, I'm happy to kick that off. We know that there are currently trials going on in Oxford and Imperial College looking at potential vaccine. What we don't know about this virus is once you've got it, whether or not you're immune. So far, it looks probably not. So a vaccine is probably going to be quite difficult to develop. We know that these kinds of viruses are very good at mutating in order to evade host responses, in order to evade vaccinations and drugs. So a vaccination is going to be quite difficult to come by. And one hopes that none of this is being rushed through. One hopes that no one is being urged to rush this through, that the scientists are being allowed to exercise their research ethics while conducting this research. In terms of the bill that was passed very quickly, it really is quite draconian. There's some quite worrying stuff in it. So police can detain and forcibly test potentially infectious, in inverted commas, people. Now, they can either be arrested or they can face a £1,000 fine. It doesn't really seem to define it any more than that. Additionally, elections can be delayed. We've already seen elections being delayed. Political assemblies can be shut down. But also, we've seen some other issues when it comes to indemnity. So if I can just quote, so that the Act enables the Secretary of State to provide an indemnity for clinical negligence liabilities arising from NHS activities. Now, that's quite worrying. We know that clinicians do everything they can to perform their duties to the highest possible standards. But this lack of responsibility, this lack of recourse for potentially bereaved families, I think is very worrying. There's also the modification of requirements under the Investigatory Powers Act. So normally surveillance warrants, etc., need to be signed by the Secretary of State and one of 15 judicial commissioners. Now that can be retrospectively, previously it could be retrospectively signed up to 3 days afterwards. The new legislation opens that window to 12 days. So people could be placed under surveillance or other restrictions essentially without judicial oversight.
Right, yeah.
So there are quite serious civil liberties implications for this.
Sure.
Some people have welcomed this act because it enshrines in law the entitlement to statutory sick pay, which is woefully inadequate on day one of sickness. And it also allows for the emergency increase in workforce. But we cannot be distracted from the very real dangers inherent in this act.
I mean, some have argued this in terms of the sickness benefit point that you made there and the furloughing of some workers, that it's a very convoluted, complicated system that they put in place. And others have suggested that a more straightforward approach ought to have been that a temporary universal basic income should have been implemented that would, obviously get to everybody and would be much easier to administer and would ensure that nobody fell through the gaps. And I know that I've spoken to people who have fallen through the gaps. And so whilst the support that has been made available is welcome, a number of people are not getting access to it. And I think perhaps a better system could have been devised than the one that they've put in place. But what they have done, of course, as I've said, where they have helped people, that is of course welcome. But I think more certainly needs to be done. But Bob, have you got any thoughts about the prospects of a vaccine, how quickly that might happen, what the civil liberty implications are, and whether indeed it's appropriate for it to be mandatory, or whether people should have the option of refusing to succumb to a vaccination?
In terms of the legislation that they've driven through, well, it appears that is the one thing they did prepare well for. It was oven ready, it was off the shelf, and it was pushed through Parliament. I'm afraid they have slipped through unnecessarily draconian law. In terms of a vaccine, as Sarah said, this virus looks like it might be particularly difficult to target with a vaccine. And what I'm worried about is this is more about a commercial opportunity for big pharma rather than an effective intervention for public health. But what the government is losing sight of, and maybe not that interested in doing, is the basic principles of testing widely, contact tracing, and isolating and quarantining people. We still haven't got that right. And how far are we into this crisis? We're at least 3 months down the line from when they should have had this plan ready. Not only are they ignoring standard procedure, but they also squandered the capacity that was available there for testing. And there are 2 types of tests you can do. One is to look for the virus itself, which is called PCR testing, which in China, they were turning around results within 4 hours. And we had all this vacant capacity for doing PCR testing in universities up and down the country, and the government completely ignored it, whereas they pursued this antibody testing, which commercial providers are interested in producing. So what agenda are they pursuing? Are they pursuing profit opportunities as number 1 priority, or is it effective interventions to save life? And I'm afraid they seem to be pursuing commercial opportunity.
I know that there is also talk in this country and of course in the States as well about the economic effects of the lockdown and pressure mounting to ease the lockdown sooner rather than later. But your colleague, Dr. Kailash Chand, the former deputy chair of the British Medical Association, says that we need mass testing before we lift the lockdown. Now, I understand in China that you just mentioned, Bob, that there really was mass testing. I mean, when you got on a bus, you were tested. Before you went into a supermarket, you were tested in terms of your temperature being taken, etc. And anybody who displayed any symptoms was sent to a specific clinic where the health workers were appropriately masked up with very substantial PPE. Is that the sort of thing you think that we should be pressing for in this country before we lift the lockdown? I mean, would you agree with Kailash?
Well, it's absolutely fundamental. How can you start to ease the restrictions unless you know what's going on? We are working blind at the moment. Coming back to testing, who did the government think to employ to do the testing? Did they keep it in-house within the NHS? No. They employed an accountancy firm, Deloitte, who outsourced it to Boots, who are also using Serco, I believe it is. So rather than learning the lessons of fragmentation and outsourcing is catastrophic, they're doubling down on their policies of privatisation. Sorry, I missed the point about mandatory vaccinations. I think that's an absolute disaster. The public they need their trust restoring, and the way to get their trust about a vaccine is to prove it's effective. And then who in their right mind wouldn't want it? But to go down the compulsory mandatory route is a step too far. And I do worry about what their real agenda is on that one.
Do you have any thoughts on that, Sarah? And there's a question that's come in from one of the viewers. You might like to deal with this one as well, Sarah. This question is asking, what are the risks of animals passing on the virus as well?
The question about mandatory vaccination, I agree with Bob. Treatment has to be by consent. As soon as you start coercing people, you damage the trust, you damage the doctor or the healthcare professional patient relationship. So it's very important that people exercise their informed consent when it comes to vaccination. Now, this virus was thought to be originally zoonotic. Okay, that means from animals, and I can't give a clear answer because I haven't read literature. Maybe Bob has. What I am aware of is that some dogs have tested positive but have not developed symptoms, but it has affected felines. Both small domestic felines and larger cats. I don't believe there's evidence that they have passed it on to their owners, but there are reports of cats becoming symptomatic. And that's close to my heart, being the servant of a 19-year-old domestic feline. But there are also reports of larger cats. I believe a tiger tested positive in America and the lions were unwell. So we do know that felines get it. Whether or not they pass it on to their humans, we don't know.
Have you heard anything on that front at all, Bob? Have you got any comment you'd like to make on that or not?
No, I think if there is a risk, it's small compared to the human-to-human transmission. So I think we should focus all our efforts on cutting that down. Something I read today, which was of interest, is how infectious COVID is from people who are experiencing no symptoms whatsoever. There's something particular about this virus that is in high concentration in the back of throats, and people who are perfectly well are most at risk of passing it on to others because they feel well, they don't take any precautions. So we must reinforce the key things, which is, to wash your hands frequently, to keep your distance, and also to avoid touching your face, because droplet spread from human to human is still the biggest risk.
I've got another question coming in from somebody called Lynn Kirby. She said, have we got a team of professional scientists, or are they just a chosen team by the government to wash over and placate the public, like Dominic Cummings? What's your thoughts on that, Bob?
Okay, so I've been campaigning and getting to know how politics and other organizations work in this country since 2012. Now, what I found locally and also at a national level is people are not selected on merit to these positions. They're selected because they are either ideologically aligned or they are relatively tame and will do what is asked of them. I'll give you a personal example. I stood to be a GP on our clinical commissioning board. And some of the questions at interview were, you're a bit too compassionate. You care a bit too much about your patients. And believe it or not, I was asked whether I was prepared to do things that are morally repugnant if asked to do so by the board.
Unbelievable.
Now, this was just to get onto a ballot paper. There was a pre-selection interview to get onto a ballot paper. And as it happened, I wasn't deemed eligible to even get onto the ballot paper. So we have government which is hell-bent on privatization. The last thing you want is somebody who's ethically and morally and politically against your agenda. They are not suitable for key positions. They are out of the picture altogether. Just as we see the journalists who are invited to Downing Street, most of them will just deliver the government message without much challenge. Well, you see that the same in the Quangos, the same in administration. Public Health England, the deputy Jennifer, I forget her second name, said that the UK was an exemplar in the way it has been handling COVID-19. Now, I challenge any rational, sane person in this country to agree that this country has been an exemplar to the rest of the world. This is the sort of advice that their appointed scientific officers come out with.
I mean, Sarah, what Bob just said there, I think, will be truly shocking to a lot of people, that he was deemed to be too compassionate. I think most people who, view health service workers, NHS workers, doctors, nurses, and indeed the ancillary workers, for that matter as well, as inherently compassionate. That's why they've gone into that field of work, why they've gone into that profession. So to be told that you're too compassionate seems just a complete anathema, to be honest with you. And I think in some ways it kind of links to something I know that you're very concerned about as well, Sarah. I know that you've spoken about this, and that is the deprofessionalisation of highly skilled staff. It seems they're trying to, as it were, deprofessionalise and desensitise people who we all sort of put our faith in and trust and love, as we've seen with the outpouring of affection with these organised applause for the care workers and NHS staff. I mean, what's your thoughts on that, Sarah?
I mean, there has most definitely been an attempt to deprofessionalise and almost micromanage doctors' careers. And this has been happening for quite some time, but it really came to a head during the New Labour years, when they introduced a new training system. And it was when the Health Secretary, the Labour Health Secretary, said that he wanted a health service filled with doctors fit for purpose. Doctors were then demoted from the status of professional to a set of competencies and had to turn up every year to have their competencies scrutinised. We were also required to do reflective exercises, and we now know that sometimes these can actually be used against clinicians. And ultimately, this was part of breaking solidarity within the profession, reducing morale, reducing, and I do believe to a certain extent, reducing competency. But we've also seen something similar in the nursing profession. In fact, in order to progress within nursing, you have to become a manager. So the management structure, the corporate psychopathy, if you like, has completely co-opted the nursing profession. And yet within these professions, you have deeply compassionate, committed people who genuinely care about their patients. But what you also have is a system which is grinding them down, which induces compassion fatigue and doesn't treat them as autonomous professionals.
So,
Could
I come in there? Could I come in this? So what the patient wants and what the professional wants is to be able to deliver high quality care in a safe environment. The way the NHS has been mutated over the years, that is becoming harder and harder to do. We are protocol driven. Our autonomy is diminishing. And as Sarah points out, we are scrutinized every year. And gradually there is mission creep. So it goes away from, are you a good doctor, to, are you following protocols adequately? And that will also morph into, are you referring adequately, appropriately, and are you not over referring? And at that point, there will be financial penalties, loss of bonuses, and also managerial pressure to stop referring the patient. And that's the system in America. You don't treat the patient in front of you, you perform to financial targets, coincide with the financial target of the organization you're working for.
If I could just add something else into this, because I think one of the key things about ensuring very often unwilling compliance with the increased corporatization and also enhancing the morale breaking nature of this is to suppress and persecute whistleblowers. And we've seen this repeatedly, and we are seeing it now. We are seeing healthcare professionals who are afraid to speak out about inadequate PPE. But there are many, there's now a catalogue of high-profile whistleblowers whose careers have been ruined because they did the right thing.
This is something I think you, Bob, feel strongly about the corporate culture that has, infected the National Health Service, that is putting the fear of God into people and making them reluctant to speak out about the conditions that they're having to work with.
Well, without it, there would be no way they could do what they're doing. Yeah. The goal of what they're doing is to erode the standards, cheapen the staff, get the least qualified person in to do the job, fragment the care, break the relationship between the doctor and the patient, and the sort of people you'll be left with are demotivated rule followers who can't get out. Yeah. And the people with organizational memory who can remember how the NHS used to be, how the spirit and the ethos of the NHS was completely different, they find it harder and harder to remain in the system, and they walk at the earliest opportunity, or even worse, that ethical, moral stance has been ground out of them. And, whistleblowing, if you make an example of one person who raises a concern in a hospital, everybody else will be silent.
I wonder if we could return to some questions now from the viewers again, if that's okay, and just return explicitly to the COVID-19 crisis. This is a question from somebody called Tina. She said, although smokers with COVID-19 have a worse outcome, there is talk that nicotine, by any method, patch, vape, etc., in the system may act as an inhibitor to the virus, apparently due to its occupying cells the virus seeks to infect. Is there anything in this? Tina says she understands that France is trialing patches. Have you come across this, either of you?
No, I haven't. But
what about you, Sarah?
I've read some reports, but I think that anything at this stage has to be treated as anecdotal, and until we have this properly scientifically analysed, I don't think we can either give people. I don't think we can give reassurance or otherwise on this. And I certainly
wouldn't recommend people going out and buying some nicotine patches then.
Certainly not. No.
Only if they're trying to give up smoking.
Yes.
But the things they can do is look at their diet. Are they getting enough vitamin C? Are they topping up their vitamin D? Are they eating enough fresh fruit and vegetables? Are they taking exercise? That's more likely and proven to be of benefit than some of these anecdotal tales we're hearing.
Right, sure.
Whatever they do, do not inject bleach.
No, it's Donald Trump was suggesting. Yes, no, absolutely, absolutely. Can we just move on then to a question from David Gannon? He said the military were not deployed on support operations until mid-March. Why did the government take so long to even authorize training for military support operations when training and reconnaissance work should have been started as soon as the pandemic was declared? Have you got any thoughts on that, Bob or Sarah?
Well, I think when you're thinking of getting the army involved, it's already too late. They should have locked down. When Italy raised the alarm, we had no excuse. It was down to individuals and other organizations like football clubs to make the decision, we're going to stop mass gatherings. The government were very slow to act. We're still having flights coming in from New York, which is America's hotspot, and there's no testing or contact tracing going. So by the time the army got involved, the fire was raging all over the country. Had they acted sooner, you would never have had to get the army involved. And I'm afraid that also feeds into this whole militaristic, we're at war nonsense. This is a medical problem. It should have been dealt with common sense pandemic procedures that have been well established for over a century. We don't need to reinvent the wheel. We just had to listen to what China, North Korea, and other countries were telling us. Sorry, South Korea.
Yeah.
Yeah.
And Sarah, Lynn has asked, should retail food workers be wearing masks and having no option but to work amongst the public as they do? Do you think that they should?
Well, I think that there's some guidance from international bodies that suggests that they should actually. Again, this is an issue of protection at work, and we've seen that people are not always observing social distancing enough in supermarkets. So yes, I do think they should have appropriate protection at work. They're coming into contact with a lot of people.
Do you think that's something that would be important from the point of view of protecting the public as well? If they are, particularly if they're working in food retail, is there a danger that by not wearing masks, they could be contaminating foodstuffs?
Yeah, I mean, we know that this virus can survive on surfaces, including things like cardboard. So it is a potential. Again, hand washing and washing fruit and vegetables properly. All of these things are very, very important. The Scottish government has taken the lead on actually suggesting that the public should be wearing masks when they're in close proximity, for example, public transport or workplaces where social distancing isn't possible, given that a lot of people are not properly observing social distancing in supermarkets. It would make sense there as well.
Yeah,
I think the thing with masks to remember is it's more important that people who are infected wear a mask, who don't know they're infected. So because none of us knows who's infected, if you don't have symptoms, everybody wear a mask. If you cough and sneeze and you don't know you're infected, then you will drastically limit the reach of your droplets spreading everywhere. It's also a psychological reminder that you're doing things differently and you may be less likely to touch your face. So all those things are important, but we mustn't lose sight of the fact that the greatest risk of transmission is within the household. 70 to 80% is spread amongst household members. Now, you're not going to wear a mask at home. Maybe some people do, but it's impractical, I think, to do that. So you have to be extra careful. This is why it's so important for frontline care essential workers to be protected, because they're most at risk, particularly in the hospital setting, where if you're in a ward full of people with coronavirus who are coughing and spluttering all over the place, the viral load you're exposed to is very high. And we know that that is a key determinant of how badly you're affected with COVID. So they absolutely need the best protection we can offer them.
Now, we were due to go off air at 8 o'clock, but because of some technical difficulties getting the live feed started, we didn't actually get going until nearly 10 past 8. I just wondered if, are you still okay for another 10 minutes to take a few more questions? Yeah. Is that okay? Are you okay, Sarah?
Yeah.
Great, thank you. Well, just ask this one then from Sue Butterworth. She said, what does the panel think about the Nightingale hospitals and the fact that they're not staffed? Any thoughts on that at all? Bob, anything on that one?
I think what this raises is a fundamental problem of misallocation of resource. So they went hell for leather to set up these Nightingale wards. Very good optics on camera on the news reports. The reality is that we have limited number of staff. So if you cut down all elective procedures and routine work in the hospital, then you have enough capacity. You don't have to put your staff elsewhere. So it seems to me like an overreaction. And they also paid for private hospital capacity. So we've ended up subsidizing and keeping alive these private hospitals. I haven't heard anything about the utilization of this extra capacity that came online. Our biggest problem has been we haven't seen the upsurge in demand, and the reason we haven't is because we've kept the most vulnerable groups locked up in their own homes and locked up in nursing homes. That is the big scandal here. We've kept the sickest who could have benefited out of the hospitals. And the government messaging about stay home and protect the NHS has had a devastating effect on people with serious conditions like heart attacks and strokes, not seeking advice because they're terrified that they may put pressure on an already overstretched NHS, and they felt guilty. And also they were worried maybe they might catch the infection from going into hospital. So if you look at it from the government's perspective, who are hell bent on ruining the NHS, they may see that as a good result. But for the normal public who want healthy life and to experience a safe NHS, that has been another silent catastrophe that's gone along with the obvious infections.
Yeah. But if I can just hear the applause now outside my window for the health workers. So clearly that affection continues apace amongst the public, certainly in Derby, and I'm sure around the country.
Well, Chris, on that, I think what we should be doing is a minute's anger at the government's handling of this. It has been an absolute disaster, you know? So express your emotion, but also realize why we're in this mess.
Yeah, no, it's good point, Bob. And I was going to say, somebody's given you a nice bit of feedback, Bob. Rob Sanderson said, good diet and lifestyle advice, Dr. Bob. Thank you for that.
Pleasure.
And I'm not sure if this question is also from Rob. It's I'm name on it. It comes directly off the leaflet, so it might be. But the question here is, are care workers without the correct PPE and ability to clean down after every visit putting our older people at undue risk? Any thoughts on that?
Exactly, that's a very good point. If you have potentially infected care workers going from house to house, what better way of infecting the most vulnerable people? You know, if you wanted to get rid of the most vulnerable people in our society, this is the best way to do it. Ill-equipped care workers to go and spread the infection everywhere. And that's what we're seeing playing out in the care homes up and down the country.
Yeah. Sorry, go on. Sarah, do you want to
comment? No, I was going to say, and we are dealing with one of the most exploited groups of workers who are not given, not only are they not given PPE, but they're often very poorly paid. They're often on quite casual contracts. A lot of them are on 0 hours contracts. And they often aren't trained particularly well. Staff retention is extremely low in the care sector. So again, we're dealing with another group of exploited workers who are potentially putting their patients at risk. They're very vulnerable patients.
And I think that's a consequence, isn't it, of the the neoliberalism that we mentioned, and the 40 years of neoliberalism. I mean, that my local authority that I initially worked for and I was then a member of used to pride itself on having an in-house social care service. So all of those workers were employed by the local authority. They were all on decent terms and conditions. They weren't paid a king's ransom, but they had a decent salary. They had sick pay conditions in place. They were entitled to a pension, before some of these things became mandatory, but to a decent pension, superannuated pension. And of course, as a consequence of using public services as a cash cow for the private sector, what we've seen is people in those occupations being farmed out to the private sector. And the way that the private sector, of course, makes its margins is by squeezing the terms and conditions of the workers. And so you're absolutely right, Sarah, that we are talking about the most vulnerable people, low paid, doing some of the most important possible work. They're caring for our parents and our grandparents, providing some of the most intimate care, and yet they're being treated, well, like dirt, really. I mean, and it's totally unacceptable. And as I say, an absolute consequence, it seems to me, of an uncaring neoliberal system. I don't know whether you would agree with that.
No, I absolutely agree with it. And I would go further. I think that the mark of a civilized society is how we treat our most vulnerable. And I would extend that to how we treat our most vulnerable workers, and certainly workers in low pay, on casual conditions, and with not very much training and protection are amongst our most vulnerable workers. And, I said it before, but I'll say it again, our current Home Secretary called them low skilled.
Can I come in there, Chris? I think
Yes.
One important thing that doctors need to realize is they are just workers as well. If you look at the hospital outsourcing, first they came for the cleaners, then they came for the caterers, then they came for the porters. And over the recent years, they've come for the junior doctors. They've destroyed their terms and conditions. They haven't given a pay rise to the nurses. Who's left? So we are now, our contracts are so poor and weak and stacked in the employer's favor, just ready for the corporates to come and take us over. The doctors need to wake up, and if not being provided with basic PPE doesn't teach them a lesson, nothing will. The government doesn't care about doctors. You might feel you're middle class and educated. That doesn't matter. You are a means to extract profit, and you are dispensable and replaceable. So wise up, get together with your cleaners and your nurses. Everybody realize that we are on the same side. The NHS workers, the social workers, and our patients are on the same side. The people on the wrong side are the people doing this to us, the government and their sponsors.
I think that's
I've got a very profound question now in the last sort of 3 minutes by Nigel. And he said, the bigger question is, post-virus, how we organise to stop capitalism just trying to reboot back to the previous normal. I mean, what he's saying is that we don't want to, when we say get back to normal, we want a new normal, essentially. What do? Can we create a new normal, Sarah, in about 60 seconds?
Well, I think it's really dangerous to use a term like new normal, because we're hearing that from the government, which has introduced extremely draconian legislation, which they intend to keep for at least 2 years. So I'd like to steer away from this idea of new normal. But certainly I think that what we've seen is a coming together of the community. We have seen solidarity like we have never seen in our lifetimes. And we can build upon that. We can have a conversation about egalitarianism. We can have a conversation about land reform. I think that we can have these conversations now in a way that we couldn't before, because we were not functioning as a community.
Bob, how can we stop going back to the system as it was before COVID-19 and the lockdown? Because we've already touched on quite a lot of the problems with it, the neoliberalism, the exploitation of key workers, the inadequacy of the service for vulnerable people. What do we do? What would your advice be in 60 seconds?
Reflect on what they've valued as most important during the lockdown. Was it getting a pay rise? Was it consuming more? Or was it having safe loved ones around you? And then think, how do you preserve that? And you preserve that by fighting for the public services. It's not about looking after number one. There is a enlightened self-interest for all of us, whatever class you're in, to fight for strong public services. We need to do something to fix the Labour Party or find an alternative, because at the moment this country does not have a political opposition, and neither does it have a media which is holding power to account. So we need to develop alternative forms of media and grassroots activism and realize that we're all on the same side. It's the 99% need to wake up, stop falling for divide and rule tactics, stop blaming immigrants or the elderly. We're in this together and we need to identify who is the enemy.
Well, thanks very much indeed for that rallying call at the end there, Bob. And as far as new media is concerned and alternative media, we're making our contribution to that tonight. And I hope people that have been tuning in have found this informative and useful. And I just really would like to express my sincere thanks to Sarah Gangoli and to Bob Gill for giving us the benefit of their thoughts on this really important issue. And just leave you with the words of Nye Bevan. Remember what he said about the National Health Service. The National Health Service will last for as long as there are folk willing to fight for it. And it's really important now, I think, more than ever before, really, for us to come together, use this opportunity to recognise the importance of social solidarity and realise that when we stand together, anything is possible. And we can not only save the National Health Service, but we can build the kind of decent, caring, compassionate society that I think the 99% of the population would love to see. So thanks for tuning in to Resistance TV this evening. We hope to have another broadcast for you next week, and I hope you'll tune into that too. Thanks very much indeed, and good night.